We've all been there. That uncomfortable gurgle in your stomach. The sudden need for a bathroom break. Digestive issues are incredibly common. They can range from mildly annoying to seriously debilitating. Millions suffer from conditions like irritable bowel syndrome, gastroesophageal reflux disease, and chronic constipation. Western medicine often takes a symptom-focused approach. It aims to provide quick relief with medications. While effective in the short term, this approach may not always address the underlying cause. This is where traditional Chinese medicine, with its holistic perspective, offers a different path. TCM views the body as an interconnected system. Digestive health relies on the balance of various organs. This includes the stomach, spleen, liver, and intestines. Disruptions in this balance, often caused by diet, stress, or lifestyle factors, can manifest as digestive disorders. In the following sections, we'll delve deeper into IBS, GERD, and constipation. We'll explore how both Western medicine and TCM approach these conditions. Get ready to discover a new perspective on digestive health. Western medicine excels in emergency care and acute situations. It uses advanced diagnostic tools and pharmaceuticals to manage symptoms effectively. However, for chronic digestive disorders, the Band-Aid approach may fall short. It often fails to address the root cause, leading to long-term reliance on medications. TCM, on the other hand, takes a holistic approach. It emphasizes restoring balance within the body's energy systems. Acupuncture and herbal medicine are two pillars of TCM used to treat digestive issues. These modalities work by addressing the underlying imbalances and promoting the body's natural healing abilities. Imagine a garden hose with a kink. Western medicine might increase the water pressure to force water through. TCM would focus on straightening out the kink, allowing water to flow freely. It's about restoring harmony, not just masking symptoms. In the following sections, we'll explore how these two different approaches tackle specific digestive disorders. You'll see how acupuncture and herbal medicine can provide long-lasting relief by addressing the root cause of the problem. IBS is a common disorder affecting the large intestine. Pain, cramping, bloating, gas, diarrhea, and constipation. The exact cause of IBS is unknown, but factors like stress, diet, and gut bacteria imbalances are thought to play a role. IBS symptoms with dietary changes, fiber supplements, and medications. Antidiarrheals, antispasmodics, and antidepressants are often prescribed. While these can provide some relief, they often the underlying causes of IBS. TCM views IBS as a disruption in the flow of qi or vital energy through the digestive system. This disruption can be caused by stress, poor diet, or emotional factors. TCM aims to restore balance and harmony by addressing these underlying imbalances. Acupuncture, a key component of TCM, involves inserting thin needles into specific points on the body. These points lie along energy pathways called meridians. By stimulating these points, acupuncture helps to relieve pain by releasing endorphins, the body's natural painkillers, reduce muscle spasms in the intestines, easing cramping and discomfort, regulate bowel movements by balancing the nervous system's control over the digestive tract, reduce stress and anxiety, known triggers of IBS symptoms. Research on acupuncture for IBS shows promising results. Studies indicate that acupuncture can be as effective as, or even more effective than, conventional medications for managing IBS symptoms. Importantly, acupuncture achieves this with minimal side effects. Section 5. Herbal medicine for IBS, soothing the storm within. Traditional Chinese medicine utilizes a vast array of herbs, each with unique properties to address specific imbalances. For IBS, herbal formulas are tailored to the individual's symptoms and underlying pattern. Commonly used herbs for IBS include ginger, which soothes the digestive tract and reduces nausea, peppermint, which relieves cramping and pain, licorice root, which reduces inflammation in the gut, and ginseng, which improves energy levels and reduces stress. Herbal medicine for IBS aims to improve digestion and nutrient absorption, reduce inflammation in the gut, balance gut bacteria, and strengthen the digestive system's overall function. Section 6. GERD, the unwelcome backflow. GERD occurs when stomach acid frequently flows back up into the esophagus. This causes heartburn, chest pain, regurgitation, and a sour taste in the mouth. Factors like obesity, pregnancy, smoking, and certain foods can contribute to GERD. Western medicine typically treats GERD with antacids, H2 blockers, and proton pump inhibitors. While effective at reducing stomach acid, these medications can have side effects. Long-term use is associated with nutrient deficiencies and increased risk of infections. Traditional Chinese medicine views GERD as a result of rebellious stomach qi. This means the energy of the stomach is flowing upwards instead of downwards, leading to acid reflux. Factors like stress, overeating, and spicy foods can contribute to this imbalance. Section 7. Acupuncture for GERD, restoring harmony, stopping the burn. Acupuncture can be beneficial for GERD by reducing esophageal hypersensitivity, making it less reactive to stomach acid, improving lower esophageal sphincter function, preventing acid reflux, regulating stomach acid production, and reducing stress and anxiety, known triggers of GERD symptoms. Studies have shown that acupuncture can be effective in reducing GERD symptoms. It can even be as effective as some conventional medications, but without the side effects. Section 8. Herbal medicine for GERD, quelling the fire within. Herbal medicine for GERD focuses on neutralizing excess stomach acid, soothing and protecting the esophageal lining, improving digestion and reducing food stagnation, and strengthening the digestive system's overall function. Commonly used herbs for GERD include slippery elm, which forms a protective layer over the esophagus, soothing irritation. Marshmallow root also soothes and protects the esophageal lining. Chamomile reduces inflammation and calms the digestive system, and fennel helps to expel gas and reduce bloating. Section 9. Constipation, when things get stuck. Constipation is characterized by infrequent bowel movements, difficulty passing stools, and hard, dry stools. It's a common problem that can be caused by several factors, including a low-fiber diet, dehydration, lack of physical activity, certain medications, and medical conditions like hypothyroidism and irritable bowel syndrome. Western medicine typically addresses constipation with laxatives, stool softeners, and dietary changes. While these can provide temporary relief, they don't address the underlying cause. Long-term use of laxatives can even worsen constipation by weakening the bowel muscles. Traditional Chinese medicine, or TCM, views constipation as a stagnation of qi and fluids in the intestines. This stagnation can be caused by factors like stress, poor diet, and emotional factors. Section 10. Acupuncture for constipation, getting things moving. Acupuncture can help relieve constipation by stimulating intestinal motility, promoting bowel movements, relaxing the muscles in the intestines, easing the passage of stools, regulating the nervous system's control over the digestive tract, and reducing stress and anxiety, which can contribute to constipation. Research suggests that acupuncture can be an effective treatment for constipation. It's been shown to improve stool frequency, consistency, and ease of bowel movements. Section 11. Herbal medicine for constipation, a gentle nudge in the right direction. Herbal medicine for constipation aims to moisten the intestines and lubricate stools, stimulate bowel movements, and tonify the digestive system to improve its overall function. Commonly used herbs for constipation include senna, a stimulant laxative that promotes bowel movements, cascara sagrada, another stimulant laxative, aloe vera, a natural laxative that also soothes the digestive tract, and flaxseed, which is high in fiber and adds bulk to stools, promoting regularity. Section 12. Finding your balance, a holistic approach to digestive health. Digestive health is crucial for overall well-being. When our gut is out of balance, it can impact our energy levels, mood, and even our immune system. While Western medicine offers quick fixes, TCM provides a sustainable, holistic approach to managing digestive disorders like IBS, GERD, and constipation. Acupuncture and Chinese herbal medicine work by addressing the root cause of these conditions. They restore balance within the body's energy systems and promote natural healing. If you're struggling with digestive issues, consider exploring the potential benefits of TCM. Consult with a qualified TCM practitioner to discuss your individual needs and develop a personalized treatment plan. Remember, a healthy gut is a happy gut.